Okay, hey everybody, welcome. My name is Joanne Rempel, and I'm a co-owner of Pure Glow Natural Skin Rejuvenation Center, and I'm so excited to have Dr. Erin Weed, who is just one of our amazing naturopathic doctors that we work with. She's an education lead, not just for our docs and our team, but also for our public. And so we're so excited to have you today, Erin, and we're going to be talking about acne and some of the myths that revolve around acne. And one of the things that we find at the center, acne is such a emotional topic, right? Because it can be something that people really struggle with. And I think it's something that fits so well into our clinic, our center, Dr. Erin, because we really work inside out, outside in. So some of the causes, but also just some of the myths that we keep hearing from people that really play on people's emotions even more. And I know you're going to talk about those today. So thank you very much for joining us today, Erin. It's so good to have you again, as always. And I look forward to hearing what you have to share today.
Thank you, Joanne. It's great to be here. Can you hear me okay?
Yes. Yeah.
I turned down my volume a little bit. I think that's just my own in my ear volume. So I just wanted to make sure that you could still hear okay. So yes, it's always a pleasure to be here to speak to our audience, our community. We chose the topic. We actually pivoted and changed our topic and decided to talk about acne today because it's just such a hot topic. People are asking us all the time, like, why do I have acne all of a sudden? Especially in the last couple of years, we've seen a real increase in people suffering with acne. And so that's why we pivoted and decided to make this our topic for this month, because it seemed very timely. So I'm going to talk today about the three most common myths. There are probably many, 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 many more, but I decided on the top three myths around acne. And then I want to talk a little bit about, I think I chose the top three things that you can do for your acne based on science, not based on myths. So that's going to be your topic for today. So let's dive into the common myths. Joanne, do you have the Facebook Live open so that you can see questions coming through?
I will open it right now. Thank you for reminding me, because I sometimes get, here we go. And I want everybody to hold on so that they can make sure that they stay till the very end, because there are some really great specials and promos that we do for this event. So make sure that you hang in with us.
And we had some tech difficulties last week, apparently, on the end of our presentation being cut off. So should that happen again, and you're interested in those promos, I think you can probably reach out to one of our team members about what they missed, just to cover that in case it happens again.
Yeah, so, exactly.
So the three most common acne myths. Let's start with number one. Acne only happens to teenagers. How many of us on the call or watching the replay believe that to be true? How many times have I heard that when people come in, like, I have acne and I'm like 45. I thought I was done with that. I was following an Instagram story, and this woman, also kind of mid to later 30s, was saying, like, skin decide, are you aging or are you going through puberty? Like, make a decision here. So the reality is that acne does happen in other periods of our time, other chapters in our lives outside of teenagehood. And I know that's really disappointing to hear, but that is a myth, that acne only happens to teenagers. And part of the reason is, particularly in those who have, dominant hormones being estrogen and progesterone floating around in their bodies, we have multiple hormonal transitions in our lives. So we go through puberty, we go through secondary puberty, which is what I like to call perimenopause. We may or may not go through a pregnancy, which is also another time where hormones will change. And I do see it sort of a change in acne presentation at that time. And then menopause. So there are multiple times in our lives where we will go through these hormonal changes. And so those are all, should we call them opportunities for acne to be of concern again. The other thing is that we are also exposed to compounds, chemicals, toxins in our environment that either mimic our hormones, so estrogen, for example, or they disrupt our own hormones. So it's not just our own sort of natural biological hormonal transitions, but we're also sort of inundated with these chemicals that mimic our hormones and then can cause disruption to our hormone system. So that's another reason why we will see acne in adults. And then there's other causes of acne. It's not just hormones, and we're going to kind of dive into that a little bit more too. But that's another reason why we see it outside of teenagehood, is because it's not just related to hormones, although that is certainly the most common cause, especially in teenagers.
Right. And I know, Erin, excuse me, I'm glad that we're going to talk about it in adulthood too, because that's one of the things that I also hear, not just in teenagers, but in mature women saying, how can I be getting this later in life, right? I've already gone through this. So I'm so glad you're going to touch on that today.
That's actually going to be the focus of our conversation today is acne in adults. We can certainly have another live next week or next month if we want to talk about acne in teenagers, because like I just said, there are different causes. In teenagers, it's typically, predominantly hormonal in nature.
Right.
And then in adults, we get into, yes, hormones, but then other causes as well. So there are slight differences in how we address it. So let's certainly, if you are a parent watching this and you have a teenager with acne, or you're a teenager yourself and you're watching this, let us know. Do you want to hear more about that? And we can definitely address that.
Absolutely. Perfect. Great.
So number 2, as far as myths around acne, is that drying the skin out is the best way to treat acne. This is the myth. This is not true.
Yes.
And actually, it was one of our estheticians who brought that to light at a meeting a few weeks ago that we had, because she hears that all the time, that that people think that if we peel our skin and we add things like that are going to dry out our skin on a continuous basis, that's what's going to treat acne. Doesn't mean that we can't use some gentle acids once in a while, but that is not the only approach, and certainly shouldn't be the only approach. The normal pH of the skin is 5.5, so it is slightly acidic. And the reason it's slightly acidic is because we have a natural layer on our skin called the acid mantle, or the lipid barrier on our skin, that actually protects our skin from bacteria, from toxins. It helps to lock in moisture. And when we dry out our skin with, let's say, soap, which actually is very alkaline, so the opposite of acidic, it's going to strip that natural lipid barrier, and therefore making bacteria more able to actually affect the epidermis of the skin. So when we have that lipid layer, it kind of sits away from the skin. But now if we get rid of that lipid layer, it now has a chance to sit on the epidermis and create issues like acne. I was like on a roll, and then I like lost my train of thought. Okay.
Can I add something to that?
Yes.
One of the things, sorry, and I don't want to destroy your train of thought, but when you talk about pH, it's amazing, because, one of the things that we always talk about is water being pH neutral, but water is a pH of about 7, right? So it is actually alkaline to the skin, right? So that's one of the reasons it's really important for us to watch in our skincare, which is, where I come in, is really at that 4.5 to 5.5. It really is in the perfect pH range for our skin.
Exactly.
So, sorry, that was my 2 cents.
Thank you. It gave me a chance to think about my thought, which I believe was this, is that when we dry out our skin, we lose moisture, obviously. And so when we lose moisture, our body's innate response is to create more oil to combat or counteract or compensate for that lack of moisture. And that extra oil is actually something that can make acne worse then. So drying out the skin is not the solution for acne. We disrupt that acid mantle that is healthy and keeps our skin healthy, and it creates a barrier that protects our skin from bacteria and toxins, and also locks in moisture into the skin. And if we don't have that moisture, we're more likely to compensate. Our body just naturally will compensate and create more oil, and therefore creating more issues in our follicles and pores. So don't dry out the skin. Not a good solution. And then the third myth, which I'm going to elaborate on when I bring in the solution pieces, is that myth number 3 is we must give up all of our favorite foods if we want to treat our acne, which also is not true. We don't need to give up all our favorite foods. Because I see this a lot of times where people will say, either they're on one extreme where they've decided to give up all their favorite foods because they're just so desperate to clear up their skin in some really severe cases. But then they're just not happy because they can't go out for dinner, or they can eat like a salad with nothing on it. They're just not happy, and it's not sustainable over time.
Right.
Or they've gone the flip side and just said, I can't do it. And so they just decide to live with their acne, thinking there's nothing else they can do. And neither of those to me are good solutions. So you don't have to give up all your favorite foods to treat your acne. So now I want to go into some of the solutions where I'm going to kind of help us understand, well, what, because there are some dietary things we can do, but what are the ones that are actually going to have a difference on our skin, where we don't have to give up all of our favorite foods. So what are the solutions? Are there any questions that came in with regards to any of those myths?
Just one, and it came to cleansing your face.
Okay.
Okay, and it was the myth of being associated. The question is how often should I be cleansing my face, and am I not cleansing enough? And I know from my perspective the answer, but I want to hear what you have to say.
Well, I think part of my perspective, I think, is also going to be part of your perspective. And we have this false belief that acne is caused by dirty skin, or like we have acne because our skin is dirty, which is also another myth. Perfect. That's another myth. I usually recommend cleansing twice a day, as long as we're using a cleanser that is the right pH. So we're not using, like, I won't name some of the drugstore brands because that's not what we're not here to bash anybody, but some of the drugstore brands are soaps, and soaps are alkaline and they will strip your skin and dry your skin. So as long as you're not using a soap-based cleanser and you're using a cleanser that is healthy for your pH and helps to actually restore your pH, you really should. I mean, I cleanse twice a day. I like to cleanse in the morning before I put on my makeup, and I like to cleanse, obviously, to take off my makeup. I would say if anything, don't forget the nighttime. I know a lot of women will get tired and they just decide, I'll wash it in the morning. Don't leave it on. If you have time for once a day, make sure it's that evening cleanse. Does that answer the question?
That was perfectly it. There's just and it leads to this emotional turmoil when you're constantly thinking you're not cleaning your face enough. So then what we do is we end up seeing people that are over cleansing and over stripping that oil, causing exactly what you said earlier, and that is causing our sebaceous glands to just produce more and more and more and more and more oil, and then we get on a roller coaster, right? So
and if it's not acne that's getting worse, let's just say, oh, well, I clean my skin lots and I use acids and strip my lipid barrier all the time. My acne is getting better, but is your skin happy? Like, is your skin more sensitive? Is it more irritated? So sure, it might make the acne a little better for a time, but what other consequences are you living with as a result? So that's also something to consider.
Yes.
So just to recap on the myths, acne only happens in teenagers. Not true. We know that. And now we talked about why. Drying the skin is the best solution to treat my acne. Also not true. We talked about that. Number 3 is you must give up all your favorite foods that you love to treat your acne. And we're going to debunk that in a moment when we talk about some solutions. And then number 4 is that acne is created by, or is caused by, dirty skin, which is not true. I think we hear the word bacteria and we think, ooh, that's a bad thing. Bacteria is not all bacteria is a bad thing. So what actually works? And this is based on the science. This is not based on someone's opinion or someone's, hearsay. This is based on the science. When we're talking about potential foods that cause acne, according to the research as well as clinical experience, mine and others, dairy tends to be the most common contributor. Is it the only cause? No, but it's the most common food contributor. And it tends to be more of an issue in people who have a history, like a family history of acne. So if your parents have had acne, if you have higher levels of insulin, which is something that we can test, you might not know that just off the top of your head, but it's something that we can test for. Or if you tend to eat a more kind of standard Western American diet, it does tend to be helpful to decrease dairy in your diet. So if you fit into those categories, you have a family history of acne, you have higher insulin levels, again, get those tested. You tend to eat a more standard Western diet. It does tend to be helpful to decrease dairy. And we'll talk about kind of what that looks like. It tends to improve acne. And that has to do with how dairy will interact or interfere with our hormones, especially our androgens or our testosterone-like hormones. Which tend to increase oil production. So that's why there's a connection between dairy and acne. And it also doesn't mean that you have to give up dairy 100%. This is the thing I said, if you love dairy, you don't have to necessarily give it up for your acne to get better. There are it appears that for some patients who eat dairy less than every day, so 6 times a week instead of 7 times a week, they actually may have less severe acne. So even giving up dairy once a week can actually help to improve your acne. And there's some research that actually suggests that less than 3 times per week may be optimal. So that's something to play around with. So maybe try cutting it out for a short period of time and then see, like, what is your tolerance? Your tolerance might be 3 times a week. Your tolerance might be 6 times a week, but you don't necessarily have to give it up completely. It also seems that whole milk products, so like higher fat dairy, tends to be less of a problem than skim milk dairy, probably because skim milk dairy has more sugar, but we don't know exactly what the mechanism is. And the other piece that I'll add here too is that for some people, protein powders like whey protein powder might make their acne worse. And for others, it can actually be an anti-inflammatory and make it better. So there's a little bit of individuality here. And so we can play around with this. There's nowhere in the science that says everyone with acne has to give up dairy 100%. There's quite a bit of flexibility, right? So give it up for a short period of time and then reintroduce it and see what your tolerance is. You might, like I said, find that you can have 6 servings a week and not have an issue.
Right. It's so interesting, Dr. Erin. If you've been watching our series of Facebook Lives, you know, this really brings to mind, right? We've talked, one of the things at Pure Glow that we're so big about, because we work in working with naturopathic doctors, is treating the skin from the inside out. And then, of course, treating from the outside in when we talk about moisturizers and cleansers and those sorts of things. But, you know, it's so interesting that we're coming back to the gut again, aren't we?
Mm-hmm.
And, you know, so many things I have learned from you and Dr. Marianne and Dr. Alex is that the gut health, and we've done, you know, we've done many Facebook Lives on nutrition and gut health in particular. So go back to our YouTube channel and certainly find our nutrition. But gut health really is the crux of so many things, and acne as well.
Definitely. Yes. When we have an inflamed gut, it's much more common that we will see inflamed skin, whether it's acne, eczema, psoriasis, you name it. Oftentimes, and that, you know, we use that as naturopathic doctors because it's very easily observed.
Right.
The outside, you know, is a manifestation of what's happening on the inside. So it's really telling.
Right. So we can always help somebody who's really struggling with acne. We can help them from 2 different directions, inside out and outside in. And that's the big difference about Pure Glow, is we really want to work with root cause. And that doesn't mean that we, you know, we don't do great topical treatments, but really, if you're really wanting to take a look at some serious permanent change, it really does involve working from the inside.
Yeah. And the topical treatments just put it over the top. Right. They add like the added, you know, they can reduce the irritation of your skin, like going back to the like when we strip the lipid barrier and we use that as our solution for acne, like I said, we get sensitive skin. So how do we keep our skin healthy while we're also dealing with something from multiple different directions? And then also like brightening the skin and maybe reducing some signs of aging. All of that those are really great things that we can do externally too.
Right. Absolutely.
So, and just to highlight, I won't say all the pieces around dairy again, but the idea is that we don't have to restrict everything. Like some people will come on these like really elaborate elimination diets, or they say to me, like, I really want to do an elimination diet and figure out what's going on with my skin. And we might not have to, right? There's actually a fair bit of suffering that can be involved with elimination diets. And not to say that they can't be a good idea in some circumstances, but we may not need to go that extreme and still get really good results. So let's look at the science. Let's look at clinical experience and see that dairy is the most common culprit. And yet we don't even necessarily have to eliminate dairy completely forever and ever and ever to still get good results.
Right.
The other thing it's also related to nutrition and inner stuff, is that lower glycemic index diets or ways of eating tend to be quite beneficial for our skin. I've heard some people kind of talk about acne as being type 3 diabetes of the skin. So it's related to insulin resistance and blood sugar dysregulation. Those are kind of fancy words, but basically blood sugar imbalances and can be related to too much sugar in the diet. So the standard Western diet has been found to be more related to acne. So like the high sugar, high fats, and so the opposite, and this is very easy to find, it's been well researched, it's all over the place, more of a Mediterranean style of eating. I really hesitate to use the word diet because it sounds very fad or temporary, but a Mediterranean way of, or restrictive, exactly. But a Mediterranean way of eating is something that has a lot of antioxidants, lots of healthy anti-inflammatory types of fats. That way of eating tends to be more anti-inflammatory also for the skin. So that actually might decrease acne for a lot of people as well. So I have an idea around that, but I need to write something down because I have an idea for Joanne for later.
Right on.
And then the third thing that can be a really great solution for acne is something topical. I wanted to throw something topical in here, and that is light therapy, which is something that we're talking quite a bit around at Pure Glow, is talking about light therapy. So light therapy, or you might find it known as phytotherapy, can be actually really great for acne. And there's tons of research. I did a little bit because there's so much that is out there, but I did a little bit before jumping on here so that I could relay some of it to you. But there are different colors, obviously colored lights, and they have different wavelengths. And those different wavelengths will penetrate different levels. So blue light therapy, literally when we're using blue light on the skin, is actually very antimicrobial. It doesn't penetrate very deep. It will be more kind of that epidermal layer. And it is very antimicrobial or antibacterial. Whereas red light tends to go deeper, tends to be more anti-inflammatory. It's better for healing. It helps to reduce scarring. So you can see that they're both beneficial for acne, but kind of hitting slightly different benefits. And then there's near infrared, and then like regular red light. And the near infrared actually goes deeper and can actually be beneficial for joints and muscles, whereas the regular red light therapy is more superficial to the near infrared. And then there's some other benefits of red light therapy too, which I think are of interest to our audience, but things like hair regrowth. I mentioned acne, inflammation, and breakouts already. It can reduce fine lines and wrinkles and sun damage. It can be helpful for psoriasis. It can be helpful for non-melanoma skin cancers, wound healing, inflammation in general. The list kind of goes on. But pertinent to this topic, it's helpful for acne and as well as healing and wound healing and inflammation.
Isn't that interesting? And we're researching this a great deal. So everything that we do at Pure Glow has been researched by both our skin specialists and our NDs. And so one of the things that's really important to us is always staying on the cutting edge. And light therapy definitely is something that we're certainly exploring, and the benefits of it.
So just to recap, I wanted to make things, there's other things, like if you go to see a naturopathic doctor for acne, there are other things that we explore, but I wanted to leave people with some things that they can easily implement today or soon, rather than and I can't make any, recommendations as far as like take this supplement at this dose. I can't do that in a context like this. But
Right.
what I can say is that the research is really strong around dairy modification, as I mentioned above. So if you've missed that part, definitely go back and listen to how I talked about how we don't have to reduce dairy completely out of our diet, but it's something that can make a big impact. Lower glycemic index ways of eating, like the Mediterranean diet, is really great. And then light therapy. These are all well-researched ways that we can really make a huge difference, not just with acne, but overall skin health in general. Yeah. Any questions, Joanne?
Yeah, well, I wanted to jump on with one thing. Can we talk about one of the things that we specialize in as far as a treatment modality goes at Pure Glow is microneedling.
Mm-hmm.
So we have had such success, tremendous success with acne and microneedling. And I know you've been there, you've been part of it, but also acne scarring.
Mm-hmm.
So microneedling is something that, do you want to talk a little bit about microneedling, or do you want me to go on and talk about it?
It doesn't matter to me, whatever.
Go ahead. You
Go
go
ahead.
ahead.
Okay. So, and yeah, microneedling is sort of our flagship service, I would say, at Pure Glow. And it has multiple benefits. We'll kind of hone in on what the benefits around acne, but basically, it's a device that will, and I want to use, language that makes it inviting, but there are about, I think it's 150 strokes per second to help build collagen in the skin. It helps to improve the healing of not just the epidermis, but the dermal layer. So the second layer of the skin. And when we are able to penetrate that layer, we can really provide a lot of, long lasting benefit to the skin. So it can actually break up scars in the sense that it will, it creates a sort of a very controlled wound and inflammation. And when we hear the words inflammation, sometimes we think, oh, inflammation is bad. Inflammation is not bad. Uncontrolled chronic inflammation is bad. Short-term acute inflammation actually reminds our body to heal. And it can actually, in this case, when we're talking about microneedling and scarring, can actually change the type of collagen that is actually in our skin. So scars are actually, I don't remember the types, but it's not the healthy type of collagen. But when we break it down, we remind the skin to rebuild the collagen, and it starts to build the healthier forms of collagen again in the skin. So it can be really beneficial for acne scarring. It can also be very beneficial for acne. We don't generally do microneedling on an active flare of acne, but if your skin is fairly clear, maybe a few lesions here and there we can just avoid, it can actually, again, because it reminds the skin to, or it creates some inflammation, it reminds the skin to heal itself. So it'll actually bring all of these immune factors and healing factors to the skin, and it can actually heal, acne as well.
Right. And we've seen on one of our models that we were using and went during our study phase, had tremendous results. As a matter of fact, two of our clients that we've been working with, after 3 sessions, saw a tremendous impact. And one of the things with microneedling that I love is, when you start putting topical skin lotions on and serums and those sorts of things, the absorption rate prior to microneedling can be very low, and once we do the microneedling, now we can absorb up to 80% of the serums that we're recommending to put on. And this is the thing that is so important, because we can give you good food for the outside of your body, but if we never take it past the epidermis, we only, and it's important to work with the epidermis, but not as critical as it is to get into the dermal junction and the dermis. So it's really important that the microneedling takes all of that good nutrition that we're giving you on the outside and takes it in deeper. So, this is why I wanted to talk about it, Dr. Aaron, because I think it's really adds that value added when we talk about acne, how we can work, definitely need to work on an inside out, and then how they can manage some things from the outside in. And that really helps us be able to serve our guests who are working with us, right? Who are challenged with acne.
So that's what I got for you today. Do you want to share?
Great. Awesome. Yes, please. That was awesome. Great material. I will share my screen. I have some great things I want to share with you from Pure Glow, and that is, let me get my slideshow. Perfect. Here we go. So we have a place that's been waiting just for you. So we have a series of infusion facials and Medi infusion facials, and these are facials that are not just they're wonderful and relaxing, and we do our best to absolutely give you the an amazing treatment facial. However, these contain some very, very active ingredients, and our skincare specialist will take you through specific to your acne concerns. So those are generally $125 because they use a lot more specialized ingredients. And until April the 30th, we're offering them for $95 if you've watched this Facebook Live. So please make sure you give us a call, and I'll give you our phone and email and all of that at the end of this presentation. So enjoy a facial, because this is where, again, we can start working with your skin and helping get you onto the proper products. And we have people that are raving about our products at Pure Glow. So our Pure Glow brands are, I'm going to start in the lower corner, and this is Osmosis MD. Osmosis MD is our medical grade brand, and I know, Dr. Aaron, this is something that you really brought to us and did a lot of research on, and then, the team really got behind it. But this is probably one of the most active brands that I've ever used in the industry for any kind of really serious skin concerns, whether it be acne or hyperpigmentation or any concerns that we're having. But really, in all honesty, the Osmosis MD is a very active brand that we recommend post microneedling. And then we have 3 other amazing brands, and of course every one of them is equally as great, but they offer slightly different things. So etymology, as you can see here in the lower right corner, lower left corner, sorry, is really a brand that was really very specific to acne. As a matter of fact, the bakuchiol oil, the hydration serum, the vitamin C serum, these are great serums that are designed really around hydration, but also for skin that is blemish prone or has acne. So these are great products. Huna is another beautiful brand, and both of these brands are actually, all 3 of these brands that I'm going to talk about are Canadian. So we're very proud of this, and created by women. And Huna was a Manitoba brand until just recently, where they moved to BC for a longer growing season. But lots of the ingredients, botanicals, are still grown here. But again, very deep penetrating. So you don't need an MD brand all the time. You don't need to use medical grade skincare all the time, only when you might be going through a healing crisis on your skin. We have these other brands that you use, really for the most part of your skin regime. And then of course, Viva. Viva is a brand that uses the waters of Banff. And it is, again, these are all as clean beauty as we can find in the industry, but also made with, incredible botanicals that have very, very active ingredients still, and are science-based. These are not just, some great flowers put in a bottle. There's great science on the actives that they're using. So take a look at our store. If you go to www.pureglowskin.com, you will see, and here's our pureglowskin.com, and use the code Acne22, and that means that we know that you were on this call, and you can enjoy 15% off all of our products. When you go to our store, please take a look at and hit categories and talk about acne, skin, or any of your skin concerns. And we will give you our suggested list of products that are designed specifically for your skincare issues. And also, you know, we will do our skin consultants, our estheticians will do a complimentary skin analysis at Pure Glow if that's what you prefer. And microneedling, we talked a little bit about it. And one of the things that we are so proud of is I love the way you put it, Dr. Aaron, and that is, it is our flagship service. And our team of naturopathic doctors and estheticians have created a really great regimen around this, because we believe in healing the skin, as we talked about, from the inside, but also from the outside. And microneedling takes skincare that one step further, but it's a giant step, because again, whatever you're putting on is going to be absorbed 80% better than what it currently is, which, you know, Dr. Aaron, I think we look at rates that we're told of 7% is what skincare can be absorbed at. So when you go jump from 7% all the way up to 80%, that's a significant amount of nutrition that's going into your skin. So what we'd like to offer you is receive a $75 gift card when you're booking any microneedling service, or receive a $100 gift card when you're booking any microneedling package. So those are some great savings. If you go to our website, take a look at our packages as well as our services. We offer naturopathic services with our skin care, with our microneedling, and we also have esthetician led microneedling services. So, and last but not least, stay in touch with us. We look forward to working with you, because you are beautiful, and we believe that the people who are looking to take care of their skin are generally people who are looking to take care of their full body. And so we're so excited to be able to bring you the concept of Pure Glow, and that is a naturopathic doctor-led clinic supported by estheticians. So here we are, we're at 1072 Pembina Highway, and there's our phone number, 204-477-9724. And then our website again is www.pureglowskin.com. And we would love to hear from you and be able to get you in for a skin consult and or a microneedling session with those great deals. So thank you, Dr. Aaron. It is always a pleasure hearing what you have to add. And again, thank you for debunking some of those myths, because it is emotional. And I can speak from a woman who's age in middle age, late middle age, but I can say, having great skin is something that we work at, right? And it makes us feel great. And I was just reading an article yesterday about how many times we're doing Zoom meetings now, and people are really starting to want to take care of their skin, because now all of a sudden we're face to face a lot more through a camera, right? And so, and these things are not going to go away. So people are really starting to pay attention to their appearance. So anyway, thank you very much. Take care, Dr. Aaron. It's always a pleasure. And Acne22, you want to remember that code so that you can get your 15% off all of your products.
Thanks, Joanne.
Thanks, Aaron.
Take care, everyone.
Okay. Bye.